Hi guys, welcome to today's video. We shall continue with the poultry diseases we were discussing in a previous video. The knowledge of poultry disease can save you a lot of money on your farm. As a farmer, especially a poultry farmer, you want to cut costs on every aspect of your farming. So consulting a vet when it comes to the health of your poultry could be an extra expenses. So cutting that cost is very possible. Your knowledge of these diseases can save you. Just one of these diseases can wipe out the whole of your flock. So you need to know them, you need to know the clinical signs, you need to know how to prevent them, and you need to know the mode of transmission. This is going to help you in preventing all these diseases on your farm. And I'm going to deal with the common ones. Just like I told you, you don't need to be elaborate, you don't need to be a vet doctor. All you need is the basic and common knowledge of these diseases. And I tell you, if you know that, your poultry business will excel. Okay, before I continue, if you have not subscribed to this channel, subscribe to the channel. You can give me a thumbs up, give me a like, comment in the comment section. Let's make the comment section as interactive as possible. And don't forget that all this is going to help this video get to other people. There are a lot of people that have benefit from these videos that I'm posting. A lot of people have contacted me personally. I gave a lot of people my WhatsApp numbers, and I really appreciate the work that I'm doing on this channel, giving out free resources for them to use, right? Hi guys, this is Oche Inaligu Leonard, and I'm here with the continuation of a video that we started before. We are discussing about poultry diseases, and we are going to continue from there. Okay, first of all, if you can remember, I divided the diseases into two categories. I divided them into respiratory and non-respiratory. I also divided them according to the organisms causing these diseases. That is viral diseases, bacterial diseases, and parasite diseases. So we started with viral respiratory diseases, and we also discussed bacterial respiratory diseases. That is part 1 and part 2. Now in today's video, we are going to discuss part 3 and part 4. The part 3 is going to be viral non-respiratory diseases and bacterial non-respiratory diseases, which is going to be the part 4. So I'm not going to waste much of your time, so we'll dive right into the video immediately. And please, I'm going to share my screen with you. So as I'm going to my screen now, what you can do for me is just to subscribe to this channel. Please subscribe to this channel, leave a comment, leave a like, so that the YouTube algorithm can push this video to other people. A lot of people have benefited from this, so don't consume them alone. Okay guys, you're welcome to my screen. This is the document that I shared with you last week. It is basically the same document, but I added some few points to it. So what we'll be discussing today, which is the part 3 and part 4, was added to the same document. Okay, so I'm not going to discuss it from the beginning again. You can watch the previous video to see my previous discussion. So we talked about the various poultry diseases. I classified them into viral respiratory diseases, bacterial respiratory diseases, viral non-respiratory diseases, and bacterial non-respiratory diseases. Okay, so you can see the classification. The part 1 is viral respiratory diseases, and in this category we have the fowl pox, which we have discussed before. We have the Newcastle disease, which we have discussed before. We have the infectious bronchitis, which we have discussed before. We have the avian influenza, which we have discussed before. Then we went to part 2, which is bacterial respiratory diseases. Don't forget, the first one was viral respiratory disease. This is bacterial respiratory disease. And in this category, we talked about infectious coryza. Okay, so now we are going to part 3, which is our discussion for today. And the part 3 is viral non-respiratory diseases. Okay, and the first on our list, which is the number 6 in the entire list, is Merrick's disease, also known as MD for short. The species affected are chickens between 12 to 25 weeks. Then under the clinical signs, we should know that Merrick disease is a type of avian cancer, so it can cause lameness and paralysis when the tumors of the cancer affect the nervous system. Then the tumors can also occur in the eyes and can cause regular shaped pupils and blindness. The tumors could also be found in liver, kidneys, spleen, pancreas, proventriculus, lungs, muscles, and skin, and can cause incoordination, weakness, paleness, labored breathing, and enlarged feather follicles. Okay, so those are the signs of Merrick disease. Then the terminal stage of the birds become emaciated, They become very thin, lose weight, and are pale, have scaly comb and greenish diarrhea. How is it transmitted? The virus is transmitted by air within the poultry house, right? It is also found in the feather denders. That is the flakes that comes from the chicken feather. Okay. Also can be found in the house dust, in the feces and saliva. Infected birds can carry the virus in their blood for life and are a source of infection to susceptible birds. There is no treatment. When it comes to treatment, there is no treatment for Merrick's disease. Prevention is through vaccination, and this vaccination is done in the hatchery, right? You see, they spray the mist of the vaccine, and the vaccine enters the eyes of the birds. That's how they are being vaccinated in the hatchery. Then infectious bursal disease, also known as IBD or gumboro or infectious bursitis. The species affected are chickens. The clinical signs: in affected chickens greater than 3 weeks of age, there are usually sudden drop in feed and water consumption, watery droppings leading to swelling of the feathers around the vent, vent pecking, feather appears ruffled. Then chickens affected when less than 3 weeks of age do not develop clinical signs but become severely and permanently immunosuppressed, meaning their immune system is going to drop. Then the transmission, it is transmitted via bird-to-bird contact as well as by contaminated people and equipment. The virus is shared in the droppings and can be spread by air on the dusts. Then dead birds are source of the virus and should be incinerated and buried properly. Treatment: there is no specific treatment. Vitamin electrolyte therapy is helpful. That is giving them multivitamins. Let me just put it that way. Giving them multivitamins regularly can be helpful. Okay. Then our surviving chicks remain weak and are more susceptible to secondary infections because of immunosuppression. That is, they can fall sick from other infections. Then the prevention of IBD is through vaccination. Okay. The next on our list is egg drop syndrome, also known as EDS. Affected species are chickens, ducks, geese of all ages and breeds. It is severe in broiler breeders and brown egg layer strain. The clinical signs: there is no reliable sign other than the effect on egg production and egg quality. Healthy appearing hens start laying thin-shelled eggs and shellless eggs. Then they could have transient diarrhea and dullness would occur prior to eggshell changes. The transmission could be from contaminated vaccines, so be careful where you get your vaccination from, okay? From infected breeders to chicks. Newly hatched chicks excrete the virus in their feces. So those are the modes of transmission. Then treatment: no successful treatment. Induced molting will restore egg production. Okay, if you're a layers farmer, you want to know what is molting, you can leave a comment in the comment section. I'm going to discuss molting. Okay, sometimes when there is a drop in egg production, they use molting to restore the egg production. So I'm going to discuss molting. If you want me to do that, leave it in the comment section and I'm going to discuss molting. Okay, then prevention is good biosecurity program. Now, before we move to the part 4, if you've not subscribed to my channel, please subscribe to this channel. This channel has been leaving a lot of free stuff for people. People have been downloading documents from the description and then we're using it on their farms. I have my contact on the document. You can see my phone number, my WhatsApp number, and my email. A lot of people have contacted me. We chat. We also chat on WhatsApp. Okay, so just subscribe to this channel, leave a comment, leave a like, so that the YouTube algorithm can push this video further. And in case you want to contact me for any help, if you download this document, you get my WhatsApp number and my email. Please no call. Even if you call, you'll not be able to get me because it's my Nigerian number and I'm in the Middle East, so it will not go. You can only chat with me via WhatsApp and email. Okay, so let's move to part 4 now. So in the part 4, we are going to discuss bacterial non-respiratory diseases. And the first on our list, which is number 9 in the general list, is called fowl cholera. Affected species It affects all domestic fowls and birds. Clinical signs are: they usually affect birds older than 6 weeks of age. In acute outbreak, the first sign could be dead birds. You could have fever, reduced feed intake, mucoid discharge from the mouth, ruffled feather, diarrhea, labored breathing may also be seen. And we can have weight loss, lameness due to joint infection, rattled noises during breathing. Then as the fowl cholera becomes chronic, chicken develops abscessed wattles, that is, have swollen bumps on their wattles. Then we have swollen joints and foot pad. Then when it comes to turkey, they could have twisted necks. So watch out for that clinical sign. Then the transmission is via addition of flocks. If you bring in new flocks to add to your former flocks on the farm, you should be careful, okay? Then free flying birds, that is, birds are flying around your poultry house, they can bring that disease. Infected environment, predators and rodents. Then the treatment, flock can be medicated or vaccinated or both. And antibiotics can be used, but it has to be in a very high level and a long-time medication in order to stop outbreak. Okay. Then vaccination, but you should know that the vaccination should be done only when there is a cholera on the farm. You don't just vaccinate them like that, like other diseases. Then another way of preventing is to prevent rodents from your farm. Then the number 10, that is the next disease, bacterial non-respiratory disease we are going to discuss, is pullorum, which is called, or also called, bacillary white diarrhea, also known as BWD. Affected species, chickens and turkeys. The clinical signs: death of infected birds and poults begins 5 to 7 days of age and peaks in another 4 to 5 days. Signs could include huddling, droopiness, diarrhea, weakness, pasted vents, gasping, chalk white feces. Please note this symptom. It is very common when it comes to pullorum. Okay? Chalk white feces. And sometimes you see greenish pigment inside. That is from the bile. So you should note for these droppings when it comes to pullorum. Then affected birds are slow. They move slowly. They are stunted because they don't have the energy. They don't eat. Survival may become asymptomatic carriers with local infection in the ovary. Asymptomatic means you may not see them having any symptoms of the disease, but they are carriers of it. That is if they survive it. Then transmission is through the egg from the hen to the chicks, right? Contaminated incubator, hatchery, chick boxes, houses, equipment, they are all mode of transmitting this disease. Then poultry byproducts, feedstuff, infected birds, they are all mode of transmitting this disease. Then treatment. Several antibiotics can effectively reduce mortality, but none can eliminate it. Eradication requires destroying the entire flock, so you need to be careful with this disease. Prevention. Normally, it is handled on eradication basis, right? Then if you are bringing in a replacement breeder, they should all be tested before the start of production to assure that they are pullorum free. Then the next on our list, which is the number 11, is the botulism, also known as lumbar neck or bulbar paralysis or alkali disease. Affected species, all fowls and even other animals, okay? Then the clinical signs of botulism. So you should know that botulism is food poisoning. It is caused by eating spoiled food contaminated with a neurotoxins produced by a bacterium, and this bacterium is called Clostridium botulinum. That is the bacteria that causes it. Then you can see paralysis. Paralysis is common and it occurs within a few hours after the poison feed is eaten. Then the neck feather becomes loose in the follicles and can pull easily. They are dull, they are sleepy when they consume a high amount of this bacteria. Then prostration and death follow in 12 to 24 hours. So this bacteria kills very rapidly, very quickly. Okay, death is as a result of paralysis of the respiratory muscles. So the lungs will not be able to move again, right? And it's going to cause death. Then transmission. It is transmitted from decayed carcass in the poultry environment. Okay, so if you have a decayed bed, be careful that the bacteria could be found in them. Then wet litter and other organic matters. So be careful, keep your environment clean, avoid using wet litters as much as possible. Then it could also be gotten from flies or maggots that has perched on a decayed substance and coming to your poultry farm, entering the poultry pen to perch on the feed of your bed or their water. Okay, so such flies and maggots can carry botulism. Then okay, botulism cannot be spread from one bed to another. You should note that. So it is only through external carriers. Okay. Then the treatment. Affected bed can be treated with botulism antitoxin injection. Okay. Then prevention. Remove spoiled food and decaying matters. Any spoiled food, decaying matters around your poultry farm, please remove them. Then in case you have dead beds as a result of botulism, it should be incinerated and buried very well. Okay, you incinerate it or you bury them very well. Do not feed them with spoiled vegetable, right? Control flies, replace suspected feed. Okay, so that's all for today, guys. So guys, I've done my study. I have studied about these diseases and I'm sharing it with you so that we can all learn and grow in our poultry businesses. So what you can do to push this video to other people is to subscribe to the channel, like the video, leave comments. If the YouTube algorithm see the activities going on, they're going to push this video to other people. I tell you, the knowledge of these diseases is very important when it comes to poultry farming. You don't need to be a guru in poultry diseases. You are not a vet, you understand, but this basic knowledge is going to help you. So let's try to push this knowledge further. Okay, like I told you before, I'm going to leave this document in the description below. You can go there and download them for free. Okay, then in case you've not watched part 1, you can go and watch part 1 of this video. Okay, and there are other videos that you see on the screen right now that are going to help you in your poultry farming. All right, so thank you guys for watching this video. I am Oche Inadugu Leonard from Greba Farms. Peace. I'm out.